Hi, my name is Julissa Viramontes, and today I was speaking to you about the many approaches to psychotherapy. Now, before we start, I want to speak about a little bit about myself. I used to live in Houston, Texas, and San Benito, Texas. I currently reside in Kingsville as I am a student at the Texas A&M University at Kingsville. I have been studying psychology for 2 years, and once I get my bachelor's in psychology, I wish to be a psychiatric therapist for adolescents and adults. Now, how did I get my research? I made a public survey for those to speak about the importance of psychotherapy and what they believe that we should take in consideration when thinking about psychotherapy. I also used credited academic websites and journals that were made by those in the psychology field, and I used blogs that were made by those who work in the psychology domain, such as therapists or counselors. As you see on the screen, there is a QR code. If you scan it, it will take you straight to the analytics of my survey. Now, what is psychotherapy? Psychotherapy is a form of talk or mental health therapy. Here, you as a client and the therapist come together and talk about any struggles that you have been struggling with, your life, recently, or anything at all, which is whether behavioral, emotional, mental, anything. Anyone can seek out psychotherapy. It's not just for those who are mentally ill. If you even want someone to talk to, it's okay to hang out with the therapist during psychotherapy. There are many approaches, as we will soon speak about. There were many tragedies. There are many tragedies that you can get help from, such as group therapy, individual therapy, family therapy, and so much more. We will only speak about the main ones or the most popular ones, just so you can get a idea of which ones will likely be brought up during a session with your therapist. Now, psychotherapy can be used alone or with medication, which we'll get more into detail on. Now, certain approaches have certain restrictions on how you may get help in the sessions, as not all of them can be online, not all of them can be in a chat room, but we'll get to that. Now, there's 5 different approaches to psychotherapy. There is psychoanalysis, psychodynamic therapy, there is cognitive behavioral therapy, dialectical behavioral therapy, humanistic therapy, and electric therapy. There's not one bigger than the other or more popular than the other, as they're all equal and they all specialize in a certain problem. They're all different. However, there are some kind of rare to find, such as humanistic, dialectical, and electric. Those are the three semi-rare ones that are hard to come by. Cognitive and psychoanalysis and dynamic are more common, which means they're more common to pop up on your insurance plan. Now, psychodynamic and psychoanalysis therapy. This is a popular first-time approach as it specializes in thoughts, feelings, and behavior that you may have trouble with. Now, if you're struggling with any childhood trauma that has been lasting a while, any bipolar issues, any eating disorders or PTSD, that will be psychoanalysis, and it will last a full session, 1 to 2 years. Now, if it's something that's recently popped up, like a loss of a loved one, acute depression, or anxiety, that will be psychodynamic, which is roughly lasts 8 months. This type of therapy can either be face to face or in a Zoom meeting. Now, each session could be roughly 40 to 50 minutes long. It all depends on what comfortability of time that you wish to have it on. Now, it focuses on childhood and teenager life. So, if you have any childhood trauma or trauma from your adolescence years, they will focus on that because they believe that pain mentally stems from your childhood. Cognitive behavioral therapy. This type of approach it focuses on what people think rather than what they do. They believe that dysfunctional thinking means dysfunctional emotion, such as if you think negative, you'll feel negative, and you live negative. This type of approach doesn't require medication. It doesn't use medication because they believe that you as a person can fix it on your own, as long as you change your thought process. This method is really good for those who have depression and anxiety disorders, as they hope to help you as a client clear your mindset, alter it to be more positive, and help see from right and wrong, as well as change your perceptions on life. This is the second most common type of therapy, and doctors recommend this type of therapy because it's most common on your insurance plan, and it seems to be, I guess, more intuitive. This approach is a short-term therapy and involves homework such as diary keeping, journaling, and note-taking. Dialectical behavioral therapy is the same thing as cognitive therapy. It's just that this type of approach is for more extreme type of people, such as those who are struggling with excessive PTSD or extreme behavioral problems. This type of therapy is mainly for those struggling with self-harm, erratic behavior, constant lying, or intense emotions. This is a short-term type of therapy. It lasts roughly to 10 months only. This approach is flexible because they believe that a client shouldn't be stressed already. Again, this is for more serious cases, which is why they have it flexible, because they don't want the client to be stressed out more than they should. Now, this type of approach does have homework still, such as note taking and journaling, and it helps really well to control intense emotions. It helps regulate any emotions you have or create very strong coping skills and as awareness for yourself, others, and the people you care about. This type of approach is known for its alternate therapy, such as animal therapy, music therapy, art therapy, to be more interactive. Both approaches take a natural role, so it's really well if you're in a culture that doesn't agree with taking medication, or you just can't because of other medications or health issues. Humanistic therapy focuses on long and short term goals. They believe that if we can alter the future, then we can alter your past, which is why they see in the future. They believe that we can fix anything by making us be more effective in the future rather than trying to see what happened to us in the past. This therapist guides the client, which is why they sit back and they want to hear how you perceive the world. They want to see why you see the world as it is, and they only step in to guide you. These sessions are, of course, a short term. They're from 4 to 6 months, and you can go either face to face, a Zoom call, or a chat room. After these sessions, you'll be able to rationalize your thoughts and actions with the people around you. Now, elective therapy is a very unique type of therapy, as this therapy takes from all the other aspects we just spoke about and puts it in one. Because of this, this therapy is mainly for those who suffer from intense PTSD. The reason why is because PTSD affects people in many different ways. We all share pain differently, we all have PTSD differently, and there's different reasons on why we have this intensive fear, which is why it takes from every type of approach and puts them in one. However, this is a really rare type of approach, and because of that, most insurance companies do not cover it, and it can be kind of costly. It's a short term which only lasts 16 weeks, and you can receive it by phone call, Zoom, chat rooms, or one-on-one in-person sessions. Medication is not mandatory, but you might have medication if you really need it. The main goal of elective therapy is to become flexible in your life and be able to handle your life and not be afraid of going outside or doing whatever that makes your PTSD occur. Now, how to start looking. This is a type of question that a lot of people have when trying to find how to start psychotherapy. And this is why I made my survey, as most of the people who took my survey state that availability, price, and power to alter sessions was a very important key points to take in consideration when looking for psychotherapy. Another would be if your therapist is non-biased, it's comfortable, it's flexible, and it has a selection of treatments that you can choose from. Lastly, another point that they did point out was that you need to bond with your therapist and that they can match your needs that you may want, to hold empathy, basically. The duration did not matter to my participants. As you can see, there is the same QR code that we saw. And again, if you scan it, it'll take you to the analytics of my survey. Now, the cons and approaches of the sessions are a tricky one, as it all depends on what you choose and who you choose. Now, most of the cons does alter depending on the academic status, the location, the experience, and the treatment they use, as well as medication if it's involved or not. The most common, which is dialectic, conjugative and psychodynamic, is $100 to $200 per session, which is roughly $65 per hour. The less common will be 250 or more. Now, if you have insurance, I did research that most insurance will only make you pay $50 more or less of a copay, and that'll be it. Now, if you don't or you can't afford any of this, the best place to try to find reduced or free type of psychotherapy would be checking out your local community by calling your mental health department for any recommendations or any mental clinics. If you're a student in the university, it's best to check out your university's health clinic or mental health clinic to see if you can get any therapy there for free. Again, price can fluctuate if medication is prescribed, as well as the length of each session. As the longer the session, the more hours you have to pay. Accessibility is another great aspect to consideration because you don't want to go somewhere that's far away from where you live. It is hard enough to really try to get psychotherapy. We shouldn't try to make it any more stressful. This is why a Google search around your community is the number one thing to do. There are two ways to make an appointment. Either be recommended by your local health doctor and they will give you a pamphlet with information, or you go out your way to make your first appointment with whoever you choose. If you do the second option, you might need this information that we're talking about today to help you look for important key points for your first session. Remember to take into consideration your needs, wants, your culture, anything that may hold importance to you, as again, we want to help you make sure that you are comfortable. Psychotherapy has been proven to be very useful. However, it's been on a decline. The reason why is because most people choose to take medication. Now, medication does help. The problem is medication doesn't make things go away. It's not like any health issues. Mental issues range differently. Medication makes you dependent on the medication. This is why psychotherapy is needed. Psychotherapy and medication together help you find a stability. And psychotherapy is made to help you get off of medication. That's the whole point, is to help you feel good about yourself, help yourself get back on your feet and have a healthy mindset and get off of the medications that you may take. The type of sessions are very useful to know so you can know which type you want to do. Now, there are four popular ones. There is face-to-face, online, group therapy, and family therapy. Now, face-to-face is where you and your therapist meet physically and talk about your emotion, talk about any problem that you may have. This one is most liked because it helps you make a bond with your therapist, and that's why people like it. Is that you can be close to each other and have like this form of connection, a connection. Online therapy is the same way. The same way, it's just that you're behind a screen. Now, there's no difference in effectiveness between online and face to face. It's all the same. You do the same exact thing for either one. It's just on preference. Group therapy is where you sit in a group with people who are similar in problems with you, with a therapist in the middle, and you speak about your issues. This is very popular for those who feel like they want to know that there's a community out there for them, who want to not feel like they are to be ashamed of themselves. A popular group therapy would be the Anonymous Alcoholics, where it was a group of alcoholics sitting together talking about their alcoholism issues. Family therapy is a form of group therapy where you and your family go see a therapist and work out any issues that you may have within your family. At the end of the day, it's all up to you. Whatever you choose, it goes. You can choose the type of sessions, the length of sessions. You don't have to stay the whole 40 to 50 minutes. You can walk out anytime, cancel anytime. You don't have to do the whole 2 years or 1 month. You can do whatever you wish to do. If you want to go one time, it's okay. There's no set rules. Make sure that everything that you choose, it's your choice. Now, there's no shame in finding one and it doesn't work out and you go to another one. There's no shame. The whole point is for psychotherapy is that you try, and if you make an error, you try again. It's a whole trial and error dynamic. It's okay if one doesn't work out for you, as another one may will. It's okay to keep trying. The best place to start is within your community. Again, it's best to start within before you look outwards. And with that, these are my resources, and thank you very much. And this is the many approaches to psychotherapy.